Hello, my name is Rob Wentz. I'm the Vice President of Customer Satisfaction and Service for Lucas Systems, a work execution software provider for warehouses and distribution centers. For anyone managing a DC today, the common topic on everyone's mind is how do we work safely and effectively in this new reality of the COVID-19 outbreak? To help address that question, today we are fortunate enough to have with us Leon Young. Leon is an improvement specialist with the University of Pittsburgh Medical Center in the field of infection prevention and construction. UPMC is a very important customer and partner with us. Over the next 15 minutes, Leon is going to share best practices for keeping workers safe amid this COVID-19 pandemic. Welcome, Leon. Thank you for joining us at a time when your job just took on a whole new level of importance. Before we jump into the presentation, can you tell us a little about your role at UPMC?
Yes, thank you, Rob. I appreciate that. As an improvement specialist, I focus on improving processes in healthcare regarding infection prevention, as well as healthcare construction. Over the years, I've gained a tremendous amount of knowledge in infection prevention and have been practicing for about 12 years now. Recently, however, my position has shifted to managing infection prevention practices in the hospitals in an effort to control the spread of COVID-19. So it's been extremely busy, but also very exciting. But thank you so much, Rob.
Well, your role and expertise directly relates to the challenges our customers and other distribution centers are grappling with. So again, thank you for sharing some best practices. First, before we start, let's take a look at the agenda. During this presentation, you're going to learn about what we know about COVID-19, how to stop the spread, what are some of the DC best practices for cleaning and disinfecting, and then in the end of the presentation, we'll give you access to more information and resources if you wish to delve further. Let me turn it over to Leon so we can find further on how to stop the spread.
Rob, thank you very much. Let's dive into a little bit here. What is COVID-19? Coronavirus disease. Coronaviruses are a large family of viruses, some causing illnesses in people and others circulating among animals, including camels, cats, and bats. The 2019 novel coronavirus, also known as COVID-19, is a new virus that causes respiratory illness in people and can spread from person to person. This virus was first identified during an investigation into an outbreak in Wuhan, China. You want to seek medical advice if you develop symptoms, symptoms such as fever, cough, shortness of breath, loss of taste or smell. Also, if you have been in close contact with a person known to have COVID-19. Also important to note is if you develop emergency warning signs for COVID-19, you want to get medical attention immediately. Some of those emergency warning signs can include things like trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse. Another one is blushed lips or face. Next, a little bit about how it spreads. Based on what is currently known about COVID-19, spread from person to person of this virus happens most frequently among close contacts, usually within about 6 feet of each other. This type of transmission occurs via respiratory droplets. On the other hand, transmission of novel coronavirus to persons from surfaces contaminated with the virus has not been documented. When I say it has not been documented, what that means is that it hasn't been studied. To do a study like that, to obtain data for something like that is very difficult to do. To actually, perform experiments to see if the virus is transmitted from surfaces to other individuals, very difficult to do. One thing I can tell you though is that coincidentally, a couple of days ago, a research came out from the CDC that they just did actually in Wuhan, China, where they did a lot of surface sampling. They did surface sampling in a couple hospital units in the hospital in Wuhan, China, where the COVID-19 patients are and have been. And the surface sampling they did showed a good amount of positive coronaviruses from the surfaces, things like hospital bed handrails, doorknobs, counters in the patient rooms, things like that. They they showed up to be positive for COVID. And as a matter of fact, even the soles on the bottoms of shoes of healthcare workers actually showed positive to be positive for COVID-19. But again, there is no documentation. There are no studies done that show that surfaces that are contaminated are then transmitted to other individuals. So it's, again, this type of transmission occurs via respiratory droplets.
So I guess it's really important for people to wash their hands often and not
Exactly.
make contact to their face.
Yes, I hear that a lot, and I actually say that a lot to everybody that I cross paths with is what I say is don't touch your face, and also included on that is hand hygiene. Transmission of, like I said, transmission of coronavirus occurs more commonly through respiratory droplets rather than through fomites. Fomites are inanimate objects such as clothing, doorknobs, etc., that are capable of transmitting infectious organisms from one individual to another. Cleaning of visibly dirty surfaces followed by disinfection is a best practice measure for prevention of COVID-19 and other viral respiratory illnesses in households and community settings. Now, all of that being said, and out of an abundance of caution, infection prevention best practices are to clean and disinfect. In addition to that, other best practices are hand washing, hand hygiene, whether it's soap and water or pure hand sanitizer, social distancing, also very important, 6 feet, wearing masks out in public when you're in public places to avoid that person-to-person transmission through the respiratory droplets. Again, the cleaning and disinfection. Washing your hands is important, but so is cleaning the devices that your hands touch all day long. Clean and disinfect are referred to in the healthcare arena as high-touch surfaces. A lot of people don't know the difference between cleaning and disinfecting. They're two very different terms and very different definitions. Cleaning refers to the removal of germs, dirt, and impurities from surfaces. It does not kill germs, but by removing them, it lowers their numbers and the risk of spreading infection. Now, on the other hand, disinfecting, that refers to using chemicals. For example, EPA registered disinfectants to kill germs on surfaces. This process does not necessarily clean dirty surfaces or remove germs, but by killing germs on a surface after cleaning, it can further lower the risk of spreading infection.
Leon, there's been questions with different types of hand sanitizer or percentage of alcohol. Is there a particular percentage that is the right amount to effectively clean your hands?
That's an excellent question. Thanks for bringing that up. I actually did a little research on that recently. And the recommended percentage of alcohol is 50 to 70% percentage alcohol. Some studies have shown that percentages that are higher, close to 90%, are actually they'll actually do almost a reverse effect, and they'll have negative effects on things you're cleaning as well. So you want to stick to right around 50 to 70% alcohol or isopropyl alcohol. The DC best practices, the distribution centers, the best practices, like I just said, hand hygiene. Wiping surfaces, end of the shift, or end of the day. You want to do that to clean and disinfect anything you've touched. Things, all your high-touch surfaces, your Lucas certified hardware, your computers, printers, touch panels, riding equipment, any of those types of things that are, again, the high-touch surfaces. You wipe those down, you disinfect them at the end of the day, the end of the shift. That ensures the next person who's going to maybe touch that equipment or possibly pick it up to use it, that they're getting clean and disinfected equipment. Also, the last bullet there, associates can wear masks when working with Jennifer or Lucas Move.
We found with many of our tests internally in engineering with many different mask configurations that there was no impact to the speech recognition. So people can wear their headsets at the same recommended distance of the boom, 2 fingers apart from your mouth.
That's excellent. That's very good news.
Excellent. And these visuals, while they may be difficult to look on in the PowerPoint, these are also available on the Lucas website to where you could print them out and put them throughout your warehouse if you think they're good for your employees.
Excellent. Now, cleaning and disinfecting, cleaning Lucas headsets. Just a couple things to go over. Always follow the manufacturer's directions on the approved cleaning and disinfecting agents. Wipe plastic and metal surfaces with alcohol wipes 70% isopropyl alcohol. To avoid damage, do not allow liquid to touch the microphone or earpiece. Never spray or pour chemical agents directly onto the device. Your foam microphone cover, that can be removed and replaced, or it can be cleaned with a mixture of water and hand soap or dish soap. Something to remember though with those foam microphone covers, you want to rinse that foam completely and allow it to air dry thoroughly before placing it back over the microphone. If you place that foam microphone cover over top of the microphone, if it's still dripping wet, that could cause damage to your microphone. So you want to make sure that is dried, air dried thoroughly. Also, the leatherette ear cushion covers on the Lucas 30, BT25, and BT20, they may be cleaned with alcohol wipes as well. Cleaning devices and scanners, kind of the same thing that I just spoke of a second ago. Very important to remember for electronics. Again, follow the manufacturer's instructions for all cleaning and disinfection products. Consider use of wipeable covers for electronics. If no manufacturer guidance is available, consider the use of alcohol-based wipes or spray containing at least 70% alcohol to disinfect touch screens, and also avoid allowing liquid to pull or penetrate devices. All of the manufacturer partners, Zebra, Bluebird, Samsung, Motorola, they have now verified that you may use alcohol wipes or clean soft cloths dampened slightly with alcohol to clean devices, including touchscreens. In addition to the obvious, the headsets, the scanners, there's also other high-touch surfaces, things like your computer keyboard that might be being touched by multiple different people. Pallet movers, the handles on there, that's the same principle as when you're in your workout gym. When you finish with some dumbbells, you put them down. There's usually something there to clean those dumbbells. You spray them down, wipe down those handles. The same thing with maybe a treadmill. When you get off one of those treadmills or an exercise bike, you're kind of expected to wipe down what you touch, those high touch surfaces. I always like to include a little bit of comedy. This is one of my favorite comics, being an infection preventionist and also a microbiologist by trade. A gentleman is in the couch talking to his therapist, and he says, there are billions of germs, bacteria, and microbes living on my body, but I still get lonely sometimes. You can find more information. There's some excellent links, some excellent tips. The first one, they're cleaning tips for Lucas certified hardware. I have personally viewed the link, and it is an excellent resource, including additional links to the specific manufacturer websites. There's also Warehouse Education and Research Council resources, also International Warehouse Logistics Association. More resources and more information available there. You also have some government resources that can be very, very helpful. You have your Center for Disease Control and Prevention, cleaning and disinfecting your facility. Also OSHA, which everybody knows what that is, Occupational Safety and Health Administration. They provide guidance on preparing workplaces for COVID-19. And then also you have two more there, Canada preparedness resources, and some UK government guidance for employees, employers, and businesses.
I just wanted to remind everybody that all of the links or reference material that was brought up earlier will be available on our website. Leon, thanks a lot for taking the time to share your insights, and thank you all for watching our presentation. Please call or email us at the addresses below, and stay safe.